Most patients that are good candidates for teeth whitenings are those patients that have those oral habits of drinking a lot of tea, drinking a lot of coffee, or that smoker that has quit. The most important aspect of that is quit. Because once you do a teeth whitening, that whitening process will receive whatever we put on the tooth. We put the gel on and it receives the whitening, but if you go right out after that and smoke a cigarette, it receives that smoke as well. But it's a process, and you have to be committed to the process and committed to making the change of some of the habits that you have. It's about 30 to 45 minutes when we do in-office whitening. Then we have the take-home trays, okay? The take-home trays, you go home and you put them in for an hour or two, and you put the whitening gel into the tray, and you go through that process for about 2 to 3 weeks. There are some intrinsic staining that takes place within the tooth that happens from birth on, and it's called tetracycline staining. Tetracycline was an antibiotic that we used a lot in the baby booming ages, but we found out later in life that tetracycline stained the permanent teeth, and it gives a brown, grayish hue to the tooth, and that stain is more intrinsic. That is a very hard stain, or a very, very hard whitening to accomplish. I have seen some changes in that process, but you don't get dramatic changes in a tetracycline stain. But I do explain to that patient, don't have high expectations. And at that point, then we will discuss possibly doing veneers at that point, depending on the patient and what they're trying to get from that whitening process.